Assalamu alaikum, and you are now tuned to Shakil and Company on America Islamic Radio. I'm your host, Kevin Shakil, and like we promised to our community that we will be here live every single night to let you guys know what exactly is going on with COVID-19. And today we decided to have my mentor, one of the co-founders of America Islamic Radio, Mr. Louis Mendez. How are you today, bro?
Salam alaikum, Kevin. It is a tremendous pleasure to be here on America Islamic Radio. As one of the founders, I want to thank everyone who over the year has supported us and ensuring that our programming gives us the ability to inform the community responsibly. For me, it's a tremendous pleasure. I'm the former Deputy Director of the Nassau County Office of Minority Affairs, and I'm also a radio personality on other radio outlets. And on America Islamic Radio, I'm a very responsible owner, making sure that the radio station comes to you in a very community-minded environment to ensure that those of you who follow the faith of Islam have a clear communication pattern with America Islamic Radio and on behalf of America Islamic Radio. Today, I think the conversation is very important. It's a somber conversation because Governor Cuomo, who's been doing a great job keeping us informed every day, told us that the numbers and the so-called curve is not looking good for the state of New York, specifically for the healthcare field. Sooner rather than later, earlier than expected, the capacity of the hospitals will be overwhelmed by this disease. And although we are trying everything we can to be able to create a social distance, as you can see here, and be isolated, it is impossible to do so without the virus spreading once the virus got started in the state of New York. We are giving it our best shot. We're New Yorkers. We have a saying, we are New York strong, and we're hoping that we will continue to be strong and stronger as the days come through. Hopefully, and then inshallah, God gives us the power, the ability, the wisdom, and the health necessary to be alive on the other side of this pandemic.
Inshallah.
Personally, Kevin, I got to tell you that I'm really concerned about the lack of communication from local governmental entities. And I'm talking about from a very specific aspect. We know that the culture, the religion, and everything else that deals with South Asian folks is all different.
Mm-hmm.
It's a great field of diversity. And therefore, American Islamic Radio is not only viewed by folks who follow Islam. It's everybody else also who wants to know what Islam is all about, which is a great thing. But we've also been getting calls nonstop asking us what's going on. And although I have governmental background, I'm no longer in government. And so I implore, I demand, and I ask of the local government officials in both counties to do their part and take on their responsibility to communicate directly to the community that speaks Urdu, the community that speaks Hindi, the community that speaks Bangladeshi, the community that doesn't speak English as a primary language, people from Iran, from Iraq, people from Kashmir, people from the Philippines, people from Vietnam, people from South Korea. They are all in need of the information that every day goes out mainstream, but it doesn't get down to the lowest common denominator, which is those communities who are ethnic communities. And historically, those are the communities that end up suffering the most.
Listen, I'm getting nonstop calls from my dad's friends who are much older, right? Who are asking me, hey, what's going on? We're watching the press conference, but we have no idea what this means. And the information's not getting out there. And, we're coming live every night to try to explain it to our peoples. But, I mean, why isn't government really doing it?
Well, there are two reasons why. Number one, they're busy, right? And so a lot of times, the squeaky wheel gets the oil, and our community doesn't know how to voice that out.
Mm-hmm.
And so what we want to do is call out. Nassau County has an Office of Asian Affairs. So I'm calling out the members and the leadership of the Office of Asian Affairs to ensure that they, along with the county executive of both Nassau and Suffolk, put together a constant bombardment of news and information to those who don't speak English as a primary language in the county. We have so-called, multiple language laws in the county, right? They have to comply. Mm-hmm. Well, no one is doing that.
Why?
So we have to make sure, well, I want to give them the benefit of the doubt.
Okay.
I want to say they're too busy taking care of the main things. But in that busyness, you have assigned people to do this.
No, but Lou, I'm trying to cut you off. I understand they're busy doing the important stuff, obviously taking care of people and trying to flatten the curve, right? But if they don't explaining to people who do not speak English, a virus is going to keep spreading.
That has been a very historical issue in the county of Nassau and in Suffolk County and government as a whole. Look, when I was in government, I made it a point that in every single press conference, I was there. I was translating. I was talking directly to the media. I would call the media. I would call upon the media. I would then do press conferences in Spanish for one specific reason. That was my job. So if there is a South Asian in the county of Nassau that works in the Office of Asian Affairs, and I'm not assuming that people want to identify themselves as South Asians, but if there is one, then please make a call to American Islamic Radio. Kevin, what's your number?
917-690-4067.
516-902-8733. We will make the studios available 24/7 for you to educate the community. We'll put you in front of our board. We'll put you in front of our TV cameras. We'll put you in front of our TVs. We will disseminate the information. But brother or sister that's out there, please give us the ability to do that, because if that's your job, then we will hold you responsible when it comes to our communities not being prepared to deal with this. Because our folks, just in case you might not know, English might not be a primary language that they speak at home. And culturally, we need to be able to then assimilate to them what's being out there and the impact that that has on them. I think that that's just a fair assessment of what we need to do at the bare minimum, which is communication. After that, we could then help you on many other levels. For example, Kevin, I want to talk to you about one concern that I have, specifically in the South Asian community, but more specifically in the Muslim community: mental health.
Huge.
We know that there is a lot of times that's a myth that people don't want to talk about in our communities, and specifically in the Muslim culture.
Not even that. I mean, now these people used to go out to work. They used to go out every single day. Now they're basically stuck at home, and they're in their thoughts. So that's not good for our community.
Yeah, hence the reason why I believe that today the Nassau County Police Department issued a warning that please don't call 911 for coronavirus phone calls. That's your doctor. And don't go to the emergency room. That's why you have the ability to get tested beforehand, so that you don't overwhelm the hospitals, but you don't bring the disease into the emergency room. That's important. I wish I spoke Urdu. I wish that I could say that to the community through American Islamic Radio. And I apologize for not speaking Urdu or Hindi or any other South Asian language. But I wish that I could, so that I would then bring it down to the grandma, the grandpa, the uncles, right? The fathers. All those folks, the papujis, the nonimas, you name it. I want to be able to make sure that they understand that they have a
You've been hanging out with too much too often.
Acha. Anyway, so going to this, I want to say this I want to beg and implore. If you're having problems at home because you're stuck at home, please work it out. Please be patient. Please read the Quran. And on top of that, please talk to your kids. Engage them. Take the phones away for a minute and have a conversation about what's happening. Maybe they'll know better than you because they're plugged into their phones. Maybe they got real information. Watch the governor's press conference every day at around 10 or 11 o'clock in the morning. Do something that allows your family to be informed. And I want to beg and ask government officials at the county level, both counties, you're doing a great job communicating on the mainstream side. Please bring it down to the ethnic side. We have Haitian brothers and sisters, Latino brothers and sisters, Pakistani brothers and sisters, Bangladeshi brothers and sisters, Korean brothers and sisters, Filipino, you name it. Nassau County has a place for everyone in the world in our county. Suffolk County is the same thing. There's one politician that I want to point out who's been doing a great job, Kevin, and that is New York State Assemblyman and Deputy Assembly Speaker of the New York State Assembly, Phil Ramos. Phil, thank you so much.
Thank you so much.
On behalf of American Islamic Radio, on behalf of the Latino side of American Islamic Radio, I want to thank you. There is no reason for you to be open right now, and you are. And your main reason is your constituents.
Listen, we did an Instagram live yesterday with Maria, who does Unscripted, right? He came to her house to give her vitamin C and hand sanitizer.
So Phil, over the last 3, 4, 5, 6 days, and I'm sure he'll continue until he runs out of his own pocket, paid for antibacterial solution, sanitizer, and vitamin C, and is delivering it at each person's door without touching them, with a mask on, driving himself through thick and thin, through rain, through sun, through cold, through heat, he's putting it in everyone's door because he knows how important that is. And you know what that shows? It doesn't show that it cost him a penny or $10,000. It shows that he cares. It shows that he's showing compassion. Most likely that person was not taking that vitamin. Most likely that person didn't have that antibacterial. And Phil is putting it in their hands. That is an example that we need to follow. And here at American Islamic Radio, we're going to make a commitment to you. We're inviting every single government official from the state to the county to the village into our studios. We will provide you with gloves. We have hand sanitizer here. We will have masks hopefully beginning next week or maybe this week. We will give you a mask. We sanitize every time somebody uses the studio. We sanitize it. And we're going to make sure that you're protected here. We're going to keep a distance, a social responsible distance. Please come out. And if you can't do that, we have a way of communicating with them through social media so that we can do a Facebook Live. What's the name of it?
So Zoom. So you don't even have to be here. We'll set up a Zoom meeting where our community can see you, you can see us, and then we'll have a conversation on the radio station.
No excuses, right? If you're a government official, especially if your job is to deal with the South Asian community, call us. What's the number, Kevin?
917-690-4067.
516-902-8733. You have no excuses. If you're a government official, call us. Give us the information for the South Asian community. Give it to us in that language, in whatever language you feel is necessary. We will put it out there on our website, on our Facebook pages, on our Instagram, and we will even take a picture of it and send it by way of text. That's how good we are with this, right? In addition to that, Kevin, I want to bring it back to the emotional side of things, right? In the South Asian community, specifically in the Muslim community, a lot of times it's a myth in dealing with emotional issues of the mental kind. Mm-hmm. And so mental health,
taboo.
It's taboo. That's the word I was looking for. And so I challenge those of you who are medical providers of the mental kind to come out to American Islamic Radio. We will sanitize, create a space for you here so that if you want to have conversation, a relaxation conversation about yoga, about perfect, great thoughts, and things of that nature, we will create that space for you for free, no charge.
Nope.
So that we can live stream that into our communities, so that people have an outlet by which to release that stress. We have Mikhail here in the Quran Tafsir, right? So I'm hoping that we could then replay him constantly. Yep. We will do that so that people can listen to the Word of God through the Quran. And I think that that's the best approach that we could do and the best help we as American Islamic Radio could do. Tomorrow you have an interview?
Tomorrow we have an interview at 8:30 tomorrow night with a pulmonologist who's on the front lines. We're going to ask him what's going on with the disease, how to prevent yourself, and what you can do, and what's happening out there right now. It's
one thing here that's important to me. Over the last year and a half and over the last 17 years that I've been involved in the South Asian community, specifically in the Muslim community, I have seen how all of you take care of your elders. They are not in a nursing home. They're in your house. And so I want you to understand something important, which I'm afraid of, is imagine you have that person in your house, but the younger generation is out and about. And they come into the house and grandma or grandpa gets sick. I just want you to know the reality is if they get sick and they have to go to the hospital, and if this is the coronavirus, that most likely will be the last time you will be able to see them. And that, my friend, is not something that I want to wish on anyone. So I want to make sure that the entire family spectrum, from the young to those who are working out hard, raising their families, to the elders who are being taken care of by those who are working hard, raising their families. I want everyone to watch our programming. Not only tomorrow night, but from now on, download the app. If you want to hear it on Mixlr, you can download the app Mixlr. Or if you want to watch us on Instagram or Facebook, all you got to do is look for American Islamic Radio. You could also watch us on the website. All the programs are there. Everything is there. So, but I also want to give a phone number, if you allow me, Kevin, which is the hotline for the state for testing on the coronavirus.
Please do, bro. Please do.
Don't go to the emergency room. Call your medical provider. And in addition to that, if you feel that you need to be tested, the phone number for an appointment is 1-888-364 3065. Once again, 1-888-364-3065 is the number for you to call in case you feel that you need to be tested. It is important for you to understand that we don't want you at the emergency room. We want you to call the hotline and get tested. Because if you show up at the emergency room and you do have coronavirus, you are going to contaminate the emergency room and you might contaminate the healthcare providers because they don't know what you will have until they actually, give you a test.
Now I have a question for you. Now, if you have somebody who really can't breathe and they can't wait on the line,
You got to call 911.
for that they can
You
call
got to call 911. Any medical emergency. I'm a former EMT. Any medical emergency where life matters, you got to call 911 and let them know that you're having a hard time breathing, that you have chest pain, whatever it is that you have, call 911 from that perspective. But if you feel that you have a fever, you don't call 911. You call your medical provider. If you're coughing, you don't call 911. Call your medical provider. If you are having chest pains and you can't breathe, you call 911. You see the difference? That is important. And I wish that I spoke Urdu or any other language. I so wish that I could explain this to you in Arabic for our Middle Eastern folks or for the South Asian community, any other language that you speak. So if you're a government official and you have the ability to communicate in ethnic languages, please come on. We have an open invitation on this radio station and also on our sister station, El Viano Radio, which is the Latino side of Studio 7. For anyone in the city watching, any doctors that want to participate in teaching our community about the do's and the don'ts of dealing with the coronavirus, for any government official in the city of New York, because we have South Asian folks in New York City, we are 7 stops away from the city. You take the train, the LIRR, out of Penn Station. 7 stops later, you're in the Mineola train station. We're 1 block away. And so I look forward to continuing this education, Kevin. I look forward to that appointment and interview that you're going to have with the doctor tomorrow. He's a pulmonologist, which is perfect. And I congratulate you for having that ability. Perfect setting for us in dealing with the coronavirus, because one of the biggest components on coronavirus is the lungs.
Yep.
Right? And so pneumonia and things of that nature. So I'm looking forward to him giving us and teaching us on what to do and what not to do and how to recognize those signs. And then also giving us perhaps a sense of calmness. Don't forget to watch, and we're going to live stream every morning, the governor's press conference on our radio station. I promise you that. And inshallah, all of you who are listening to us will be alive once this is done.
Inshallah.
Okay? And may God bless you all. And I'm going to leave you with one thing that I know that is very dear to all the Muslims' heart. Helping each other as brothers and sisters is not just helping yourself or doing the right thing by your religion. It's actually doing the human thing. And the one thing I've come to learn about Muslims and their faith is that as an entire community, as an entire people following a religion, you're very not only giving, but very peaceful. And sometimes that givingness allows for 2 things to happen. You don't know how to demand from your government officials the ability to communicate with your folks. Sometimes you think that that's even disrespectful. But that's not the case. You're a taxpayer. And the second part is, a lot of times the leaderships in your communities hold you down because they want the power and influence for themselves and not for the people. We at America Islamic Radio, we don't deal with higher ups or lower ups in a classification. We treat everybody the same because that's exactly what the Quran says we do so. And although I'm not Muslim, I'm very proud to be able to learn the ability to teach and treat people in the same manner that I want to be treated. So I need you to demand more of yourselves, to cooperate within your family. If you're young, don't go out.
Stay inside.
Stay inside. If you're an elder person, please stay away from the young kids that come near you until they clean their hands, change their clothes, and wear a mask and gloves. And if you're mom and dad taking care of young and old, God bless you. May God bless you always, because it's not an easy job. You got to understand each other. You got to lean on each other so that you can get through this in the best way possible. Once again, my name is Mendez from America Islamic Radio. I wish you the best, and may God always give you the ability to be alive to live life to the fullest and to help all you brothers and sisters. Thank you so much.
Thank you guys all so much. We will continue being live every single night at 8 p.m. Assalamu alaikum.